Good afternoon, and thank you for tuning in to today's Seminole County Press Conference. This afternoon, you will hear from the Emergency Manager, Alan Harris, Sheriff Dennis Lemma, the Florida Department of Health Officer, Donna Walsh, and OneBlood Vice President, Susan Forbes. First, I'd like to give you a few highlights. My name is Lee Constantine. You've been seeing the chairman, Jay Zimbauer. He is out of town, and I am taking over for today. And I am very proud to announce that Seminole County will have a new economic development grant program. We will begin administering this emergency grant program for county-based small businesses that have been negatively impacted by the COVID-19. This is one-time grant that will provide critical support to help offset the significant loss of revenue during the pandemic. Eligible businesses will receive up to $5,000 in funding that may be used for rent, mortgage, utilities, payroll, employee retention, and PPE materials. This grant is funded by the CARES Act through Community Development Block Grant funding. Therefore, only those businesses with employees who receive low to moderate salaries at $19.59 an hour or below are eligible. This includes restaurants, bars, retail establishments, personal services, pet care, cleaning services, small fitness centers and gyms, and event services. Additional criteria includes businesses must be located in unincorporated Seminole County or one of the county's 7 cities, except for the city of Sanford, who is doing their own small business grant program. Businesses cannot be home-based and must have a minimum of 1 employee other than the owner on payroll, and no more than 25 employees. Businesses must affirm a loss of revenue due to the COVID-19, as well as other criteria. The pre-application process will begin Monday, June 1st. Interested businesses can learn more about the grant and application process at seminolecountyfl.gov/business-in-Seminole. That, once again, seminolecountyfl.gov/business-Seminole. We also have a consumer confidence survey, and the Economic Development of Seminole County has launched this consumer confidence survey to gauge how comfortable residents are while shopping, dining, and conducting business. As a service to businesses, these results are published 3 times a week at prepareseminole.org. prepareseminole.org. See the business tab to take the survey and view the results. As of today, over 700 residents have completed the survey. At this time, I'd like to introduce and welcome our Emergency Management Director, Alan Harris. Thank you.
Thank you, Vice Chairman Constantine. Alan Harris, again, Emergency Management. To give you an update on our response to COVID-19, over the weekend we did see a slight bump, and over the last week a slight bump in positive cases here in Seminole County, and we continue to monitor that closely. We are continuing the Emergency Operations Center to push personal protective equipment to assisted living facilities and nursing homes in an effort to prevent the spread of the virus in any facilities. At this point, there are no major outbreaks in any of our ALF and nursing home facilities, and testing is being done in multiple facilities each day to make sure that that stays consistent. Each day we also have representatives contacting individuals that are isolated and quarantined in their home. We have right now about 100 individuals that are isolated and quarantined in their home, either because they have confirmed cases of COVID-19 or they are under monitoring or what we call PUI, or persons under investigation status, because they've come in contact with someone that has COVID-19. Over the last week, we have been working with some amusement parks. Yes, we have some here in Seminole County, We've been working very closely with folks that run amusement parks, helping them to reopen based on the governor's executive order. So we are reviewing in the Emergency Operations Center their safety plan as per the requirement of the governor, and then sending letters of endorsement with the business leaders' request for reopening to the state. So far, we have had success with this. Little 500 race carts, which is down in Fern Park, has reopened. We are working right now with the Central Florida Zoo to reopen some of their amusement rides at their park. We also sent a letter last week to the Executive Office of the Governor requesting vacation rental opening here in Seminole County. We provided a draft safety plan based on best practices from across the state and CDC. And we hope to hear very soon from the Executive Office that we are approved here in Seminole County for reopening all vacation rentals based on that safety plan. Tomorrow, we will have the second in a series of, and they're the same each week, but the second in a series of faith-based leader presentations. We will have faith-based leaders here to present information on what they're doing in their facilities to protect their congregations as they reopen. So we're very excited about that. It'll be a presentation tomorrow at 1 p.m. You can get information on the presentation through our website, social media, or by calling our Citizens Information Hotline at 407-665-0000. The Citizens Information Line is staffed Monday through Saturday from 8 a.m. to 5 p.m. for your convenience. As we near hurricane season, we don't want to think about that, of course, but our second named storm, I can't believe it, our second named storm, and we're not even in hurricane season, hit the coast of South Carolina today. Luckily it was a very low-level tropical storm when it hit, but we don't, of course, want any of those, but we have to think about the hurricane season as it begins next week. Hurricane supplies will be tax-free starting on Friday, May the 29th through Thursday, June the 7th. So if you would like to go out and purchase some hurricane supplies, this is an opportunity to do that tax-free. You can purchase things such as flashlights, batteries, coolers, radios, generators, things like that. This hurricane season, as I have been talking about over the last about week, we are going to see things slightly different. Emergency shelters, we used to call them emergency shelters. This year they will be called Refuge of Last Resort. They won't have quite the creature comforts that they had, and over the years we've tried to build up caches to make things a little bit more comfortable in those facilities, but because of the amount of social distancing and the amount of shelters and things like that that we will have to open to meet CDC guidance on social distancing, things will be slightly different. Our focus this year, of course, is to get out of the storm, get out of the way of the storm. So if you're able to evacuate away from the storm way prior to traffic getting bad on the interstate, this may be the opportunity to do that. So we want people to think about that as the storm is starting to approach. We will be calling evacuations a little bit earlier. If you live in a concrete or masonry block home, we encourage you to review when your home was built and when the roof was constructed, if you've had the home re-roofed. Your concrete masonry block structure may be just as sound as going to a refuge of last resort, which is generally in schools. If your home is not safe, the third thing that you should look at is evacuating to a friend or family member's house that has a concrete masonry block home. So talk to your family and friends and see if it would be okay to come over if a hurricane starts to approach our area. If none of those three work, evaluate going to a hotel or motel. That would be the fourth option. And then the fifth option is if you can't do any of those things, certainly think about a shelter. The shelter or the Refuge of Last Resort provides a little bit of services. We provide 3 meals a day, and those meals will be done in a time fashion where we used to have all meals provided at the exact same time. This year it will not look like that. There will be time slots based on groups inside of the emergency shelter. There is limited space for individuals, so each individual will be given a space of 7 foot by 3 foot. Many people have seen in past hurricanes these cots and things like that. Those are provided after a hurricane passes by in a refuge of last resort. It's space on the ground. Bring your sleeping bags, bring your clothes, and those types of things to be as comfortable as you can in that space. Family units can sleep together, of course, so each person is given a 7-foot by 3-foot, and then you can add on to that. And that's based on the American Red Cross and FEMA's guidance. And then there will be social distancing of 6 feet in between each family group, where in shelters we used to have a group and then immediately follow and connecting almost to them. We had another group and another group and another group. Now it will be one group, 6 feet, and then another group. Staff and residents at the shelter or the places of last resort will have their temperatures checked prior to being allowed into the refuge of last resort, as well as a questionnaire to see if there has been any exposure to COVID-19. We are asking staff and residents to bring facial coverings or masks. If you do not bring a facial mask or covering, one will be provided to you at the shelter. Hand sanitizing and protective measures will be available at the shelter. At the special needs shelter, we are asking for just one caregiver over 18 to accompany each client due to the limitation of the space in the special needs shelter. With that, I'd like to turn it over to Sheriff Dennis Lemma.
Thank you very much, Alan, Vice Chairman Constantine. Again, there's been very little change in the criminal justice report throughout the county. From the first week in March, I said that there was really minimal impact on the law enforcement services, both at the county level as well as the city level. And we've done a pretty good job out there warning people, giving recommendations on tips of CDC standards and best practice. Still no citations that are issued to anyone, and any calls that we get right now are calls out there to make sure that everyone is educated and aware. So in the interest of brevity, there's been no changes when it comes to the law enforcement perspective in the traditional sense. I will move because I've spent a considerable amount of time talking about our Department of Corrections and our effort to make sure that we direct file on those misdemeanor cases and trying to minimize the spread of the virus within our correctional facility. And between the last time that I appeared before you at a news conference, we've had actually 2 cases where inmates have tested positive for COVID-19. One was an arrest for a violation of probation, and another was a transfer from the Department of Corrections. Now, I am pleased to say that because of the practices we've put in place in our correctional facility, those individuals were quarantined on the front end. They both voluntarily participated in a COVID-19 testing, which initially tested positive, and now one of the inmates have tested negative twice, and the other has tested negative once. We're awaiting a second negative test on the inmate. I share that because the backside of that is there were 17 employees of the sheriff's office that had to be self-quarantined based upon potential exposure. God willing that they all tested negative, but in the end, you never know. So it was 17 employees that potentially were exposed to these individuals. So that's kind of some of the effects that we had, not only from a financial standpoint, from a public safety standpoint. No spread in our facility, and I'm very proud of the practices that we have put in place. The last part of my comments, I'll kind of restate something that I've stated all along. I think that the most challenging obstacle that we will face is the underlying conditions that are present within our community and the collateral consequences associated of this pandemic, meaning the demands placed upon social services. We know that domestic violence calls are now starting to increase. I think as our economy starts to get going again and our business start to open, we start to familiarize ourselves with those people who have been victimized at home. I think that from the beginning of this thing, we've seen that the dependence on opioid use disorder and other types of substances were as steady as they were before this. I can only think that this pandemic has resulted in more people turning to substances as a coping mechanism. And I think that we all recognize the prevalence of co-occurring issues with mental health and substance abuse. So I think as we rotate out of this, as a society and a community, we need to make sure that we're there to support those individuals that have needs. We've got a 40% reduction in reports of abuse, neglect, and abandonment, which is extremely misleading. The 40% reduction, as you've heard in the past, is only because a lot of these children are not at school, where there's mandatory reporters with school teachers and other people that can see bruising and other signs that raise suspicion. And again, these are things that we will have to work with. I will tell you, as sheriff here, and I think that my counterparts in local government, I've had this conversation with many of our commissioners, a lot of our constitutional officers. I don't think that you'll ever see government go back to business as normal. I think one of the positive effects of this pandemic is we have realized how productive we can be without the dependence on brick and mortar and all the costs that's associated with that. The sheriff's office alone, we have about 400 people that have been working remotely, and they have been as productive or more productive working in this remote environment than even how they were before. So as we kind of look at budgets and we look at the impact and we look at helping our community, I think that this is something that all government will take into consideration as we kind of rotate out on this. And last and certainly not least, we are already ramping up our investigative and preventative efforts on this new problem that we will face with cyber type of crimes and computer type of crimes, when many businesses are being thrusted into cyberspace, when companies who had never operated with a global digital footprint before are now forced into that environment. I fear that there's going to be a new way for people to victimize. And it's important that we have our team ramped up, working with those businesses, companies, and individuals, making sure that we educate and inform them on how to protect their business interests. It's just not flipping a switch and saying we're going to go to an online business now. There's some risks associated with that as well. So with that, we will continue to work with our partners at the county and local level. And it's my privilege to introduce somebody who's been incredibly busy and a great partner with us, Donna Walsh, our director of our local health department here in Seminole County. Donna?
Thank you so much, Sheriff. Good afternoon, everyone. As we do every week, I would like to just provide an update on where we are today with the number of cases, not only here in our county, but also in the state of Florida. This graph should look familiar to many of you. You'll see that the orange line again is the number of lab reports to us every day, or the lab report date, in other words. And then the blue line is the onset date of symptoms, which lags behind the report date as we do our case investigations. You'll see we had a little bit of a blip here within the last couple of days. And, you know, as I reported last week, we were averaging between 0 and 5 reported cases a day. We did have a couple days last week where we had 7 cases reported one day and 8 cases another. So to put that a little bit in perspective, again, for the week of April 26th, we had 41 total cases reported. The week of May 3rd, 15, May 10th, 14, and then this past week we had 23 cases reported to us here in Seminole County. So you can see a little bit of an increase there. Since our businesses opened partially on May 4th, Seminole County has had a total of 72 new positive cases reported. So what does this mean? Well, this means that the COVID virus is still circulating in our community. And although we are gradually reopening, and as Sheriff mentioned, we have to look at the other public health implications of isolation and quarantine for such a long period of time on our economy and our mental health and so forth. We're messaging to everybody and encouraging everybody to continue to be vigilant and to do this a step-by-step approach, as has been mentioned by our governor and our federal government, because it's really important that we protect each other from getting this virus. There are those that are more vulnerable, as mentioned from the very beginning, to complications from this virus. The deaths that we're seeing are primarily in the elderly, although it doesn't mean that younger people can't get this infection, because we do have reports of younger people getting the infection. In fact, in Seminole County, 295 of our 471 current confirmed cases are in the age group of 25 to 64. Those over 65 are 110 cases, and then those less than 24 are 66 cases. So we've seen anywhere from infancy all the way up to over 100, age group reported with this infection. It's just those that have the underlying health conditions and those who are elderly tend to suffer the most complications and oftentimes die, unfortunately. We still have just reported 12 deaths in our county. Fortunately, no further deaths have been reported to date. And we continue to expand testing opportunities for those in our community. We really don't and can't understand the spread of the virus unless we offer the testing. A lot of private agencies are offering, as they have from the beginning, our hospital systems, our urgent care facilities, many of the private labs, LabCorp, Quest diagnostic labs. We are providing what we call pop-up community testing. Just last Saturday, we were at St. Mary Magdalene, where we provided 413 tests. And so tomorrow we'll be at Bueno Pharmacy, which is off of 1792, where Bravo Grocery Store is located, and Ambassador Church. We will be providing testing there tomorrow, weather permitting. We're going to continue. It does look like from the National Weather Service, the forecast is bad weather after 2 p.m., so we will be there, and then we'll go accordingly. This coming Saturday, we'll be at the Kennel Club in Longwood providing testing as well. The testing is open to anybody, free of charge, whether you're symptomatic or not. So please come out if you have concerns. We have doctors present in partnership with Bueno Pharmacy, the American Muslim Community Clinic, and the Health Department. We do have clinicians present in the event that you are symptomatic and would like to be evaluated on site. That can be done. So, as Alan mentioned, although we have a total of 471 confirmed cases, we're following about 100 folks, and those are contacts. You've heard that term, contact tracing. It's very important for us to not only talk to the folks who test positive and make sure that their needs are being met, but also those people who are in close contact and make sure that they stay in quarantine for that incubation period of up to 2 to 14 days in the event that they do become symptomatic and need medical care, and also to keep them from spreading the virus to others. So as we continue on, I know that you have also heard about antibody testing. You'll hear a little bit more about that in a few minutes. But antibody testing also helps us to understand the spread of the virus in our community. For those who may have been asymptomatic or mildly symptomatic and maybe never went in to get tested, if they do get an antibody test, that can indicate whether or not they've ever had the infection. So we did get a preliminary report from the state last week that indicated that in Seminole County, we've had about 1,400 people that have had antibody testing done, and out of those, 61 tested positive. So that's about a 4% positivity rate versus the 2.5% positivity rate we're seeing when we're doing these pop-up community testing. So, as we continue to test, we have about 3.3% of our population that has been tested so far, not even 20,000. We're a little over 18,000 tested out of over 470,000 population. So we do need to continue to provide that testing opportunity for others. With that being said, I'd like to call up OneBlood to talk to us more about antibody testing.
Good afternoon. I'm Susan Forbes, Senior Vice President, Communications and Public Relations at OneBlood, and we are very happy to be able to let you know that we also at OneBlood are providing antibody testing. So all blood donors who donate with OneBlood will receive the antibody test as part of the standard testing that we already perform for infectious diseases. This is a great added benefit for donors who are coming in because they may be wondering if they did have the virus at any time, and this will be able to let you know if you have created that antibody and if you had the virus, even if you were asymptomatic. In addition to being able to know personally if you have it, you also could potentially become a convalescent plasma donor. And OneBlood has been collecting convalescent plasma now from people who have recovered from the coronavirus for the past couple of months. And this is very important because people who have recovered from the coronavirus create an antibody to the virus, and that antibody remains in the the plasma portion of their blood. And by transfusing their plasma into a person who is still fighting the virus, it could potentially boost their immune system and help them recover. So this is something that our hospital partners throughout our service area are using and are continuing to use. And we've been able to create a ready convalescent plasma supply because so many people who have recovered have stepped forward with OneBlood to donate, and that is tremendous. And we encourage people who recover from the coronavirus to please reach out to OneBlood. We will continue to collect convalescent plasma for the foreseeable future. Also, you can find all that information at oneblood.org, and you can also find about antibody testing that we're doing at oneblood.org as well. You will be able to get your antibody results from OneBlood about 48 hours after you donate, and you can just log into your donor portal at oneblood.org, and you'll be able to see what your results are to the antibody test. We will be providing the antibody test to the coronavirus for the foreseeable future at OneBlood. Something that we've learned throughout this entire pandemic is the need for a ready blood supply. It simply doesn't stop for anything, not even a pandemic, so we encourage people to continue to make blood donation a habit. We have seen a tremendous response throughout our service area and in Central Florida to making sure that blood donation remains a priority. We've seen a lot of first-time donors come forward as well, and that is great, and we hope that you will make this a beginning of a lifetime habit of donating blood. The only way to prevent a blood shortage is to make blood donation a habit. And every time you see that big red bus or a donor center, we hope that it's a reminder of you to go ahead and schedule that appointment to make your next donation. This is not a one and done for the blood center. This is something that is impacting our operations for quite some time, the pandemic, and we anticipate this will be something we will be dealing with for the foreseeable future. All businesses are not back open, and that's traditionally where you find the big red bus for blood drives. We have moved to appointments only, and you can make appointments at oneblood.org or by calling 1-889-DONATE, and we will schedule that appointment. We've implemented social distancing across our service area, so the appointments will also help with that and streamline your donation process and ensure that we're collecting the right amount of blood each day to meet hospital demands. We are also very happy to be partnering with Seminole County government. They have stepped forward also to host additional blood drives. They've been tremendous partners throughout our time, and they will be having additional drives on June 9th and 10th at public parks and at different government offices, and you can find a complete listing of those blood drives at prepareseminole.org. And again, everything that you need to know about the antibody testing and the convalescent plasma collections at OneBlood can be found at oneblood.org. Thank you.
Thank you, Susan, from OneBlood, and Donna, of course, great job as always, Donna Walsh. The sheriff, I think all of us feel good about the fact that he's in charge of our public safety. And Mr. Harris, you've been doing a remarkable job, and I appreciate it. And I want to thank everybody here that's in attendance. One of the things I did want to add, in that emergency grant program that we're having for small businesses, at the current time, we are looking at over $1 million that we are putting in that through that CARES Act program. So this is not going to be insignificant. This is going to be able to help many of our small businesses that truly need it, so that we can give them that boost. They can get back to work, their employees can get back to work, and we can do something to really revive this community as we continue to go down the path of protecting our citizens. With that, we will have a Spanish translation of the key points after the questions, if there are any. And I would like to thank the Florida Department of Health, Seminole County Public Information Officer Mirna Chamorro. And Mirna is going to be giving us a little bit of the translation from Spanish. Are there any questions?
Yes, Commissioner Constantine, we have several questions texted in from the media. Ryan Lynch from the OBJ has questions on the small business grant. He asks, how important will this grant program be for small businesses in the area?
Well, thank you for the question, Orlando Business Journal. It is extremely important, but the businesses have to use it. And there is the program. I gave the how they can check on it through our website. But the fact of the matter is because it's well over $1 million, there's only 5,000 per company. They have to have an average employees of 1 to 25, not including the owner, and there have to be people that are making $19.59 an hour or less in their employment to be able to do this. So this is for small businesses that are directly affected, the bottom line of the COVID-19. So those are going to be, it's going to be extremely important to touch those folks, make them understand that we are here to help, and that they will be able to have some protection, if you will, from the pitfalls that they have received.
The Orlando Business Journal also asks, how much money will be available for the grants, and how many businesses will the county look to help?
Well, I just said over $1 million. So if you divide that by 5,000, that's well over 200 companies that will be able to be helped.
Okay. We have a question for Donna Walsh.
I'll get back in the corner.
Rosener Jean-Pierre from Radio Haiti Tropical asks, with the raining season and the upcoming hurricane season approaching, what kind of impact will this have on COVID-19?
I think that's a co-answer with Alan Harris, our emergency manager, too. For the last several weeks now, we've been planning for our special needs shelters as well as general population shelters and what those might look like in the event that COVID is still going on, which we certainly anticipate that it will be. So we have to practice social distancing and the hygienic practices that we've been messaging. We certainly need to look at staffing and surge. There's a number of things that have to be planned for with the event of the hurricanes coming on. So, Alan, I don't know if you want to mention any further. No, those plans are being done on a local level as well as a statewide and federal level. So we're taking guidance as it comes. We have received some preliminary guidance at this moment, but there's more to come, and of course, we'll be tailoring that for the needs of our community.
And Alan, we have one more question for you.
Yes.
If residents do arrive at the refuge of last resort, what will happen to them if they do have a fever or are showing symptoms?
So, excellent question. So we're looking at a couple different types of shelters. Of course, we have our special needs shelter for individuals that require oxygen or require electricity to run some type of medical device. As I mentioned last press conference, it is important for individuals to register. So if you have one of those needs, register now with the Office of Emergency Management. That way we can prepare for you with the proper medical staff. We can get the oxygen providers and those types of things ready for you. If for some reason either you have COVID-19, you have flu-type symptoms, we're looking at opening up an isolation shelter. This is different than a special needs shelter. It's a shelter specifically for individuals that have to isolate and quarantine, so that no one will be near each other. Everybody will be very, very socially distanced, in fact, sometimes in separate rooms. We're also looking at a non-congregate sheltering type of opportunity where we would be utilizing some hotels and those types of facilities to house individuals who are sick or have some type of sign or symptom. It doesn't necessarily have to be COVID-19 because we wouldn't know at that time. It could simply be the flu, but we want to prevent any spread of any type of virus in our shelters.
Those are all of our questions.
All right, well, thank you.
Thank you very much for being here, and now I'd like to introduce Mira. Myrna, excuse me. Come on in, Myrna. Thank you.
Muy buenas tardes. A continuación, el resumen de la conferencia de prensa del Condado Seminole. Lee Constantine, vicepresidente de la Junta de Comisionados del Condado Seminole, indicó lo siguiente. La Oficina de Desarrollo Económico del Condado de Seminole comenzará a administrar un programa de asistencia de emergencias para pequeñas empresas con sede en el condado que hayan sido afectados negativamente por el COVID-19. Esta es una ayuda de una sola vez que brindará apoyo crítico para ayudar a compensar la pérdida significativa de ingresos durante la pandemia. Las empresas elegibles recibirán hasta $5,000 en fondos que pueden usarse para alquiler, hipoteca, servicios públicos, nómina, retención de empleados y materiales de protección personal. Este programa de asistencia está financiado por la ley CARES a través de fondos de asistencia global para el desarrollo comunitario. Por lo tanto, solo aquellas empresas con empleados que reciben salarios bajos a moderados, que sería $19.59 por hora o menos, son elegibles. Esto incluye restaurantes, bares, tiendas, servicios personales, cuidado de mascotas, servicios de limpieza, gimnasios y gimnasios más pequeños y servicios para eventos. Los criterios adicionales incluyen las empresas deben estar ubicadas dentro del condado de Seminole no incorporado o en una de las ciudades del condado, con excepción de la ciudad de Sanford que opera su propia asistencia para empresas pequeñas. Las empresas no pueden estar localizadas en el hogar y deben tener un mínimo de un empleado que no sea el propietario en la nómina y no más de 25 empleados. Las empresas deben tener una pérdida de ingresos debido al COVID-19, así como otros criterios. El proceso de solicitud comienza el 1 de junio y las empresas interesadas pueden obtener más información visitando seminolecountyfl.gov/Business in Seminole. La Oficina de Desarrollo Económico del Condado también ha lanzado una encuesta de confianza del consumidor para evaluar qué tan cómodos se sienten los residentes cuando están comprando, cenando y visitando los negocios. Como un servicio a las empresas, estos resultados se publican 3 veces por semana en prepareseminole.org. Consulte el área de negocios de la página de internet para realizar la encuesta y ver los resultados. A partir de hoy, sobre 700 residentes completaron la encuesta. Luego, Alan Harris, que es el director del manejo de emergencias del condado, mencionó que durante el fin de semana el COVID-19 se vio un pequeño alce en los casos y lo seguimos monitoreando. Todavía se están proporcionando equipos de protección personal a los hogares de ancianos en un esfuerzo por prevenir la propagación del virus en estas instalaciones. Cada día, nuestros representantes se comunican con personas aisladas y en cuarentenas en sus hogares. En esta semana hemos estado trabajando con líderes empresariales para abrir las atracciones en el condado. Revisamos su plan de seguridad y ya algunos han abierto, como por ejemplo Lil 500 Race Cards ha abierto ya. También enviamos una carta a la oficina ejecutiva del gobierno para reabrir los alquileres para vacacionar. Esperamos que puedan escuchar y muy pronto se puedan también recibir la respuesta. Habrá una presentación de líderes religiosos el jueves a la 1 de la tarde. Es la segunda en una serie y se presentarán, ellos hablarán sobre qué están haciendo para proteger a sus congregaciones. Los suministros para huracanes están libres de impuesto en la Florida comenzando el viernes 29 de mayo hasta el 4 de junio. A las personas no se les cobrarán impuestos por las ventas por artículos como las linternas, las baterías, refrigeradores, radios y generadores. Durante esta temporada de huracanes las cosas van a ser diferentes. Si puede, con tiempo, salga del área donde vive, lejos de la tormenta, temprano, antes de que comience el tráfico. Si vive en una casa de bloques de concreto, es posible que no necesite ir a un refugio. Así que revise cuándo se construyó su casa y su techo. Si su casa no es segura, desaloje y vaya a casa de familiares o amigos que tengan una casa de bloque también o de concreto. Evalúe si debe ir quizás a un hotel o un motel local. Y si no puede salir, pues vaya entonces a un refugio, lo cual debe ser su último recurso. Refugio de último recurso, recuerden que se van a proveer 2 comidas en ese refugio, pero es por horarios ahora. El espacio será limitado a 7 por 3 pies por persona y cada familia debe estar junta y luego habrá distanciamiento social 6 pies entre cada grupo de familia. El personal y los residentes del refugio serán evaluados, incluyendo tomarles la temperatura, y se le harán preguntas relacionadas a que se han sido expuestos al COVID-19. El personal y los residentes que necesiten refugio deben traer una máscara o cubierta facial. Se establecerán desinfectantes para manos y otras medidas de protección en el refugio. Y también recuerde que solamente una persona que cuide a esa persona mayor de 18 años debe acompañarle. El sheriff Dennis Lemma del condado Seminole pues también ha dicho que pues desde que comenzó a hablar pues ha habido muy poco cambio en cuanto a la ley, a las policías. Ha habido un mínimo impacto, pero sí han hecho una buena labor en educar a la comunidad. Así que no han habido citaciones, pero sí en la cárcel anteriormente se había mencionado de 2 casos que eran positivos al COVID-19. Debido a las prácticas que ha implementado la cárcel, que fueron aislados y se le están realizando las pruebas, pues ya uno de ellos salió negativo una vez y el otro 2 veces ha salido negativo. 17 empleados potencialmente fueron expuestos, pero también salieron negativos gracias a todos los esfuerzos que la cárcel ha estado realizando. El desafío es las consecuencias de las pandemias que podemos ver en el futuro, como por ejemplo con la violencia doméstica. También ha habido un 40% de reducción en negligencia en cuanto a los niños, y esto puede ser que sea malinterpretado, ya que quizás no está bien reportado, ya que muchos de los que reportan son los maestros en las escuelas y los niños pues no están en las escuelas. Hay un efecto positivo que podemos ver de todo esto, y es que la oficina del sheriff ha sido muy productiva y el gobierno pues ya definitivamente no va a ser el mismo. Se ha visto la producción en donde ellos pueden, y todos del gobierno, realizamos las labores sin tener que estar confinados a cierto lugar para realizarlas. Y sí, también se está educando a las agencias, ya que ahora puede sí aumentar los crímenes cibernéticos y de computadora. Donna Walsh, directora del Departamento de Salud en el condado Seminole, mencionó que en la gráfica la línea anaranjada significa los laboratorios reportados y la línea azul es los síntomas que han comenzado de las personas. Y sí se ha visto un aumento en los casos un poco durante estas últimas semanas. Desde la reapertura parcial de los negocios el 4 de mayo, el condado Seminole ha tenido ya 72 nuevos casos positivos reportados. El número ha ido aumentando cada semana, desde las primeras semanas en abril 19 al 25, que se vieron 44 casos, luego fue bajando a 41 casos, en mayo del 3 al 9, 15, y en mayo del 10 al 16 se vieron 14 casos. Ya esta última semana de mayo subieron otra vez a 23 los casos que se han reportado. Así que ha habido un aumento en casos, pero está estable. Y sí queremos dejarles saber que el virus sigue circulando en la comunidad y transmitiéndose. Así que hagamos nuestra parte en esta reapertura del gobierno poco a poco y que sigamos siendo vigilantes, ya que las personas más vulnerables son las personas mayores de edad y las personas que lamentablemente han fallecido también son las mayores de edad. Aunque personas de todas las edades pueden infectarse, y es importante pues que si usted tiene síntomas pues, se realice la prueba. Continuamos expandiendo las pruebas en la comunidad. No podemos entender el virus en la comunidad a menos de que se hagan las pruebas. Y sí estamos colaborando con la Clínica Comunitaria Musulmana y también la Farmacia Bueno para realizarse estas pruebas. En la última prueba el sábado en la Iglesia Católica St. Mary Magdalene hubo 400 personas que se realizaron la prueba, sobre 400 personas. Los próximos eventos son este jueves 28 de mayo en la Farmacia Bueno, en el área de Sanford, y también el sábado 30 de mayo en el Sanford Orlando Kennel Club. Pueden visitar prepareseminole.org para saber toda la información de los diferentes lugares donde se realizan las pruebas. En cuanto a pruebas de anticuerpos, datos preliminares indican en el condado Seminole que de las 1.400 personas que se han hecho la prueba, 61 personas fue positiva. Eso es un 4% de la tasa de positividad. Así que al momento 3.3% de la población se ha hecho la prueba en el condado de Seminole. Y queremos indicarle que continúen haciéndose la prueba para que pueda de esa manera conocer. Luego estuvo con nosotros también la persona de OneBlood. Ella también habló sobre si las personas pues donan sangre, de ahora en adelante van a poder saber si tienen anticuerpos del COVID-19. Están haciendo las pruebas a todos los donantes, así que si usted se está preguntando si tiene los anticuerpos, si ha estado expuesto al virus, pues al ir a donar sangre le van a hacer la prueba de anticuerpos y se tarda 48 horas para que usted pueda saber los resultados de la prueba. Estas pruebas benefician a las personas no solo porque usted puede saber si ha estado quizás expuesto al virus, sino también porque puede ayudar a identificar los donantes de plasma. Y si se está utilizando, muchos de los hospitales están utilizando el plasma y puede ser un buen tratamiento para las personas para fortalecer, si tienen el virus, fortalecer su sistema inmunológico y potencialmente mejorarse. Las donaciones de sangre son por cita solamente de ahora en adelante, así que pueden visitar oneblood.org o llamar al 1-888-9-DONATE. Recuerde, importante también hacer un hábito de las donaciones, y así es que se puede mantener ¿verdad? Los bancos de sangre fuertes en estos momentos en cuanto más se necesitan. También puede visitar prepareseminole.org para ver cómo ellos están colaborando y saber en el condado de Seminole cuándo son las donaciones de sangre. Muchísimas gracias.